Thank you for joining us this morning. My name is Dr. Ronit Lev. I'm an emergency and addiction physician and Chief Medical Officer for CCR, Center for Community Research. Today, we are proud to announce an innovative prevention project regarding the interactions between cannabis or marijuana and prescription medications. Every day, I treat patients in the emergency department with marijuana poisoning. Every day. Patients present with various conditions, one of which is interactions with prescription medications. Patients are simply not aware of the dangers of mixing prescribed medicine and cannabis, both marijuana products, THC, and CBD. For example, during a recent shift in the emergency department, I cared for a 64-year-old man who came back to the hospital for the third time for internal bleeding. At this time, each time he came to the hospital, he had blood transfusions, had endoscopies, looking with a camera to search for the bleeding, and finally, the cause of his revolving door to the hospital was discovered to be a medication interaction with cannabis. He was on blood thinners for his heart stents, but he was also taking recreational marijuana that was interacting and making him more prone to bleeding. Blood thinner medications become more potent when mixed with THC or CBD. Lack of consumer protection and proper labeling have left consumers at risk for potential harmful consequences. Another common drug interaction is the additive effect of pain medications, anxiety medicines, depression medicines, and sleeping pills. They can interact and cause oversedation. An example is a gentleman who came into the hospital because he couldn't sleep and his family gave him some pot brownies. That helped him sleep, but now he couldn't wake up, and he had to be admitted with encephalopathy caused by these drug interactions. Our project on cannabis drug interactions will do two things. It will provide consumer information on drug interactions, and it would also evaluate whether the public is interested in receiving such consumer protection information in the future. Drug interaction cards will be attached to every prescription with our partner pharmacies. We will distribute 12,000 cards in English and some in Spanish to 17 pharmacies in San Diego County. Each information card includes a link to answer 4 simple questions to evaluate whether the project is beneficial to them. And we really want people to complete the survey, and so we will incentivize folks that whoever completes the survey may be entered to win a $100 Amazon gift card. And with that, I will pass on to Dr. Sung Oh.
Thank you, Dr. Lev. Thanks everybody for joining. My name is Song. I'm a pharmacy supervisor here at Sharp Rees-Stealy Pharmacy, Santee. We're happy to host the event here in front of our pharmacy. The Santee Sharp Rees-Stealy Pharmacy is one of our 8 pharmacies that will be participating in this drug interaction project. Our other pharmacies are located around San Diego, in downtown Chula Vista, Rancho Bernardo, Sorrento Mesa, La Mesa, San Diego, Maine, and Otay Ranch. According to the latest San Diego data, there were 29 cannabis-related emergency visits a day. Some of these can be prevented by awareness of drug interactions between cannabis and medications. Currently, very few or any pharmacies around the county provide drug interaction information with marijuana products. That's why Sharp Rees-Stealy is proud to be a participant in this consumer protection project. We are not here to say anything about using cannabis one way or another. We're just simply here to increase awareness that just like how drinking grapefruit juice could interact with important medications, cannabis could potentially do the same thing. And we're here to bring this very important issue to more people, more patients around Greater San Diego and hopefully around the nation as well. Our patients will have a chance to win $100 for answering simple confidential questions such as, were you aware of drug interactions between medications and marijuana cannabis products? And would you want a warning if your medications have a serious side effect with marijuana cannabis products? The survey will help us determine if the public wants this type of drug interaction information. Thank you everyone for joining us again today, and I will now pass to Dr. Nirmal Patel from Scripps Health.
Hello. My name is Nirmal Patel. I'm the Director of Pharmacy Services over at Scripps Health, over our ambulatory and retail pharmacies. And I'm really happy to be part of this collaboration with the UCSD Sharp Rees-Stealy, and Allen's Pharmacy in this important project. Marijuana is legal in California, but what a lot of people don't know is that it's not safe for everyone. People should be informed of the drug interactions between THC, CBD, and their medications. This is why 3 of our pharmacies are going to be participating in this drug information project, including Scripps Green Ambulatory Pharmacy, Scripps Encinitas, as well as Scripps Mercy. Our pharmacists receive training on the cannabis, drug interactions, as well as various emergency visits related to marijuana. They'll be encouraging clients to participate in the evaluation to determine if our customers are interested in this kind of information. I will now pass this on to Dr. Ram Penaranda.
Thank you. My name is Aaron Penaranda, and I'm the Pharmacy Director at Allen Pharmacy in downtown San Diego. Our pharmacy clients are vulnerable and have complex medical and mental health conditions. They may be on multiple prescription medications. They're often not aware of the drug interactions that exist between their medications and marijuana. That is why we're eager to participate in a unique project to raise awareness among our patients and hopefully prevent further hospital visits. Pharmacists have a unique job that requires disseminating important information about medications. It is quite common to see on prescription labels, "do not take with alcohol" or other drugs. Unfortunately, marijuana use is often overlooked. This info card will help us understand the level of readiness the public has for information like this. Our pharmacists have been trained in answering questions related to this project in the hope that this project will spark an ongoing conversation about patient safety and cannabis use. I'll now pass this to Joe Eberstein.
Thank you. Good morning, everyone. My name is Joe Eberstein, and I am with the San Diego County Marijuana Prevention Initiative and the Center for Community Research. It's very inspiring to have 17 local pharmacies participating in this project, probably one of a kind in California and one of a kind in the United States. You can see behind me all of our community partners, ranging from treatment to HIDA to a lot of other pharmacies that are interested in this project. We greatly appreciate and admire their readiness to provide a new type of consumer protection that may be the first of its kind. Lack of knowledge around this issue is causing people to end up in the emergency room, and that's a fact, to the tune of 29 marijuana emergency-related visits a day. We know this because the Center for Community Research tabulated that information and got the data. With this project, up to 12,000 people will receive information about drug interactions between cannabis products and medications. Patients will be referred to drugs.com to use as a resource to check for dangerous drug interactions between THC, CBD, and their own prescription medications. On the information card, a QR code will direct patients to fill out a quick survey. The information gathered will help us understand what types of information are useful to patients and where the gaps may be. We have instructed pharmacies to direct further questions that patients may have to the MPI website at ccrconsulting.org/MPI. It's also listed on the info card. Thank you for coming, and we'll now open it up for individual questions. And thanks, everybody.